You have leaking of membranes, and now what? So, what is leaking of membranes? It's when you have a sudden gush of water which has started to come, and it does not look like urine, it's a bit slimy, like slippery, and it's as if you have no control, it just came. So, this ideally should happen at the end when the baby is about to come out. Like when you're like almost bulging membrane, that membranes are so tough, they hold the pregnancy inside till the end. When you're like 6-7 centimeters, that's when they're supposed to break, and it generally proceeds with delivery. But sometimes it happens early. So it can happen in second trimester also, especially if the water bag, the uterus is infected. There is something which is like, not safe for the baby, and those membranes are not healthy and they literally leak, and that baby is not viable. Secondly, it can also happen in second trimester, third trimester, 32 weeks, 34 weeks, 37 weeks, and term at 9 months, like 38, 39 weeks, and you don't go in labor. So there is a component of infection, and then there is this component, especially near term, there is a component of the baby not being in the right position. Because the baby, for it to come out, it has to be in a perfect sacha, we say, like a perfect, like a jigsaw puzzle. It has to fit exactly in that puzzle so it smoothly comes out. So it's not able to do that, and the uterus is constantly contracting. That's when the water bag breaks, because there is no proper alignment and there is constant contractions, but it's not aligned, it breaks water. So there are different lines of management for both leakings. So if you are leaked in second trimester, it depends on which country you are. Like in India, anytime you have any leaking, your pregnancy gets terminated, because they consider it as a life-threatening thing, because it can. So we just start the termination. We don't conserve the pregnancy. But it's different now because of the IVFs and a lot of precious pregnancies. So there are people who are conserving their pregnancies at the risk of taking the risk of chorioamnionitis or the infection. But in countries like UAE and world over, where termination is not so easily available, we have to weigh the risk and benefits. If the mother is fine and the baby is fine, then we continue the pregnancy. But it requires a lot of monitoring. Literally, like sometimes be inpatient to be monitored every 4 hourly. Sometimes if you're okay, we might send you home, but you have to come every 3 days for checkup. So like this monitoring will continue. So most of the times, if you have leaked, the chances of you delivering are higher. And if you have not delivered, the chances of you getting infection and complications are also there. But at the same time, there are known cases who have leaked at say 18 weeks and they have gone till like 27, 32, 34 weeks also. So that's why the value of that baby's life it's valuable. So we give that a chance. But at the same time, we are monitoring you for signs of infection. Any sort of greenish discharge, offensive smelly discharge, fever, not feeling well. You need to report immediately, and we need to deliver this baby ASAP. Now when this happens in 9 months, end of 9 months, when you leak, and your baby is mature, it can come out anytime. So anytime you leak, we offer you induction. Especially if you are not showing signs of labor, established labor. We can offer you induction in the form of prostaglandins or in the form of oxytocin. We also check GBS sometimes. If you are having this bacteria, you get offered immediate induction. We ask you, please, let's start labor. It's not worth waiting anymore, because there is more risk of baby getting infection, because induction takes time. So once you get induced for leaking, then you will deliver. But there are some patients who don't want to get induced. They wait 24 hours. And suppose if they are GBS positive, they get antibiotics every 4 hours. And we wait. If nothing happens, then we offer induction. And once we offer induction, we hope that you deliver normally because it works. Because all you need is the power, as in the contractions, to push the baby out. And if the baby just enters into that jigsaw puzzle, just fits into that jigsaw puzzle, it will come out. So that's our ultimate hope. So remember, near term, if you leak, our plan is to deliver. You deliver with induction or cesarean, whatever, cesarean risk will always be there, but aim is to get the baby out. Before that, depends on infection risk and you overall. How are you doing? How is the baby doing? If both of you are safe, we might conserve the pregnancy at least till 34 weeks. If either one of you becomes sick, you or the baby, immediate delivery.